Hi, I'm Larry Blackburn. I'm your reigning king of Fantasy Fest.
Hi, I'm Bernadette Restivo. I'm the Fantasy Fest Queen for 2018. And we're here today to ask you to come to AHMonroe, formerly known as AIDS Help, here at the corner of Kennedy and Flagler, to have your free HIV test done. We believe so much in the HIV testing, we're gonna go have our tests done on camera so that you can see what it's all about and take the mystique and fear out of an HIV test.
Come down here. There's absolutely no reason not to be tested. It's not going to cost you anything. It's not painful. It's confidential. And it's something you ought to know.
Absolutely. So come on in with us and let's see what's going on inside the doors. Hey everybody, this is Scott Pridgeon. He's the executive director of AHMonroe, and he's here to greet us and give us a little tour of what's going on.
Get on in the house.
Yeah, it feels like home. It feels like home.
We try to make it like home. We try to make it as comfortable as possible. Because a lot of times when people are thinking about coming through that door, they've had to maybe agonize a little bit about taking an HIV test. Maybe they're worried about what the results are going to be. Or they're just routinely, this is normal for them to have this part of their health plan to be tested regularly, which we recommend everyone to be tested regularly. So whatever the case is, when you walk through that door, we want to make sure that you feel welcomed so that we can counsel, assist, help in any way we can. Our testing lab.
Okay, so this is where we're going to get
Yes,
tested.
and it's our testing lab is completely confidential. The HIV tester will come in, and we actually do couples testing. We do have couples that will come in, and they can test together. And we also do, obviously, women, men, children. We can actually test children. We don't have to have the consent of the parent. But at the same time, we also, before we administer a test, and when I say a child, I mean someone who might be under the age of 18, maybe 13 to 18. But before we give that test, we really want to know why they're here. So we don't want to administer a test to a young person without really knowing why they're here and if they're actually sexually active. Obviously, there's no reason to have an HIV test if you're not sexually active. So we want to sort of counsel that and guide that before we test someone under 18. But there is no official rule that we cannot test someone. We can test anyone who says that they are sexually active.
Hi, I'm Randy. I'm one of the HIV testers here at AHMonroe, and I'm about to give our queen, Bernadette, HIV test.
And Larry too.
And Larry too, I'm sorry. King Larry.
Okay.
All right. So first thing first, we have to get some consent forms signed.
Okay.
These are required.
And that's a consent for you to test us.
Consent to test, consent that you understand it's a confidentiality, and consent that if we did have a reactive, we would do a confirmatory just to be sure. But these are about 99% accurate tests.
Okay.
And I'll explain those to you as we go to them.
I don't like having my fingers pricked. I don't like having blood drawn, and I'm not going to look.
This is more like people check themselves for diabetes. It's very small, little tiny, little drop of blood. So.
Wow.
All right, so first here, the first form is you're giving me permission to give you an HIV test. You have to sign consent. Yes, right there.
The lawyer in me wants to read it, but I'm going to trust you. Okay.
No one's going to see this. It's a confidentiality statement. So,
okay.
This is saying that everything we talk about is confidential. It's between you and I. I'm not going to leave this room. We'll sign right there.
So not anybody else in
this is one of the most highly confidential documents in the U.S. right now, actually.
Really?
It goes in that envelope and sealed for 7 years. The only reason that we have these is if we ever get audited by the CDC or Department of Health. We are actually real people, and we've given you your rights.
So this is the Center for Disease Control of the country?
They oversee all of this, yes, through the Department of Health.
Okay.
And this last form...
Do I need to date it?
I'll go ahead and do that.
Okay.
The last form is stating that this test is very accurate. More, the new rapid tests are very accurate, 99%. If we had a reactive, it's more than likely an HIV positive, but we would still do a confirmatory test, a blood draw, at another facility to send to a state lab to have a confirmation test. So, and you understand that? It's initial, sign, and printer.
Okay. And so you called it a rapid test?
Yes, it's a rapid HIV test because it takes less than 15 minutes for the results.
Oh,
Back in
okay.
the day, it was 2 weeks.
Oh
and
my
I
gosh,
think that's
okay.
right.
It is rapid. And how long have you been testing here, Andy?
4 years.
Oh, okay.
Mhm.
How many people do you test, say, in a month?
It really depends because we're so seasonal, you know. It's but probably in a month we average 20 to 30.
Okay. Well, we're hoping to get more people to come in and test now that we're doing
I
this.
think everybody should be tested. No, we're gonna do that. We're gonna do this finger right here. Okay.
The middle finger?
This is the one. Either these two they recommend. I don't
Okay.
know.
Oh, I think the middle finger is kind of funny.
Okay.
Oh, please.
Quit shaking.
Am I shaking?
All right. Unfortunately, I can't use that first drop of blood because of the alcohol, but I'm going to count for you. All right. You're just going to feel the spring pop more than anything. 1, 2, 3. That's it.
I did not feel that at all.
See?
I heard it.
See?
Ah,
Okay. Can't use that first drop, so hold that if you would.
uh-huh.
Okay.
That was a big nothing.
This is not going to
No,
stick to.
back in the day when they used to use those little lances.
Yeah.
No,
Oh, yeah.
those
Oh, yeah.
things. I mean, it's like
Yeah, an X.
it's a little dagger.
All right. This isn't going to stick
That's
you. This is
nothing.
just going to absorb the blood on the surface there. Okay.
I'm still not gonna look at
Okay. All right. That's all right. That's all
it.
you
Is it,
need
is
right
it
there.
red?
It's green.
Should be purple.
Okay. All right. Hold that again.
Got it.
All right.
That really was nothing.
All right. So let that sit. Okay, you can pull that cotton off.
Uh-huh.
All right.
Now, do you label these anonymously, or you haven't? Well, how do you know who's who's here?
That's yours. No, okay, so I'm not going to do layers at the same time.
Oh,
So
okay.
It'll take 5 to 10 minutes really to give it a result.
Okay.
In the meantime, we fill out this, and this is also part of the test, confidentiality, and it helps me to kind of find out what your risks are.
Okay.
So there's a series of questions and everything.
So let's
First we
go over
do
the
your-
questions, but we're not giving answers.
Right.
on-
Okay. Okay. So normally I would just write your name, name, address, phone number, just for auditing purposes. Like I said, this just goes into a file. If the CDC ever did come and want to see, or Department of Health want to see our records, you're a real person, and everything.
Okay.
The bottom portion are statistics that I put into a database, female, age, that kind of thing. So we'll just go with the statistics. I usually ask people's birth date, their ethnicity. Then I go over race, self-reported gender, because we don't want to assume anybody is this or male or female or anything. So we have self-reported gender, and then your birth sex. We do ask for that too. And then if it's female, we ask if they're pregnant. If they're yes, if they're in prenatal care. Okay, so we do that. Also, while we're doing this testing, and one other thing we look for is for domestic abuse. We're required to look for if you see any bruising or we see any kind of signs of that. We have a form that we're required to fill out too. And it's a question about if somebody is being abused in their home and if they want care. And so
Wow,
we do that.
that's great.
Mm-hmm. So then it goes down into, have you had a previous HIV test? And you said this is your first test and everything? Okay. And then we ask about PrEP, if they've been on PrEP or if they know about PrEP.
Can you talk to us a little about that?
Sure. PrEP is a once-a-day pill for people to take that keeps them from getting HIV. It's about 99.99% effective. And what it does is if you had been out the night before and you maybe did some things that you don't normally do, and you possibly have been infected with HIV, and you're on PrEP, which you have to take every day, it will keep the virus from multiplying. If a virus can't multiply, it goes out of your body in waste.
Well, that's
So
incredible.
it is incredible.
How long has that been around?
It's been around for years and years. It was available mostly in the physician and nurses and hospitals and firefighters and things like that. If they had been needle stuck or something like that, they would put them on medications for 28 days. Well, they've refined it now to one pill, basically. So now it's available to the public. And
Is it a prescription?
yes, it's under prescription. Every 30 days you get a 30-day supply. Every 3 months they want to check your liver, make sure your liver functioning is right, and it's not, but side effects, there haven't been side effects. It's pretty safe.
And does it get covered by insurance?
It is covered by insurance. It depends on what type of insurance you have, of course, and everything. Your copay. There is a copay on some insurances. There's a program in the state of Florida. Every health department is giving PrEP for free for people making under $48,000 and uninsured.
Wow.
So you can walk into any health department in the state of Florida and get PrEP.
That's great.
Yeah, but insurances do cover about half of it. And if you're above that 48,000, you can usually get a copay card from the manufacturer to help pay for the other half of it. So it's minimal, really.
Okay, so it's PREP.
PREP, PrEP.
Simple. Okay.
Now there's another form called MPEP, and PEP is more for people that have been maybe victim of rape, or people that have gone out and did something crazy the night before, and they wake up and they go, oh my gosh, if I had been exposed, we could put that person on 28-day medication of its PrEP, and it's another pill for 28 days. And if they had been exposed, there's no way to tell, but if you think you had, you can go on this medication for 28 days. And if it had been exposed, it will keep it from replicating and also go out of the waste.
Wow.
Mm-hmm. The other big thing that they kind of thought, kind of came to light in the last couple of years was somebody that is positive and has taken their medications like they should every day. It keeps them in what's called undetectable. So they can't, it's not in their blood or their semen or their vaginal secretions or their breast milk or whatever to be able to pass it on to somebody else.
So it's like a
So
barrier.
undetectable, yes. If they're undetectable, you can't give another person HIV.
Well, how would you know if you're undetectable? Are you undetectable to the test?
Well, people that are HIV positive go every 3 months or every 6 months and have their blood work done.
Okay.
And they look for your viral load, and they also look for your CD4 count. So we want to make sure they're healthy on their immune system, and they don't have a big, large virus, amount of virus in their bloodstream. So
Okay.
undetectable is really what we want to get to.
Okay.
So I would jump over into risk factors. So I would ask some personal questions about if you've had vaginal or anal sex with males or females, depending on where they're, and if you've had sex without condoms, or if you've knowingly had sex with somebody who was an intravenous drug user, or if you've knowingly had sex with somebody who was HIV positive. Then we go down to for women, we ask them if they've knowingly slept with a man that has sex with men also. So all these are kind of giving me the tools to help counsel you to protect yourself. It's
Okay.
part of having an HIV test.
So this is more than just you being nosy.
Right, exactly. And I
This is a
explained
little
that, and
awkward, I
explained
think,
it.
for people to come in and,
Absolutely,
it's
absolutely.
unusual to be asked.
Mhm. We asked about anonymous partners, with today with all the hookup sites and everything. We ask about if you had sex for drugs, money, and other items for sex workers too. I want to teach them how to protect themselves also. And also HIV, if they've injected drugs themselves. And if they share needles, if they have, we ask that too. And the last question we asked is how many sexual partners do they think they might have had in a 1 year's time? So all these questions help us to better prepare that person to protect themselves. So if you're having sex with no condoms and everything, we talk about PrEP, we talk about condoms and everything. We talk about risk factors. A lot of guys think that as the person on top of everything is not going to get it. Well, this is my little visual here. If you don't have a condom on, this is your penis. I mean, you can still get things in there. If you get an STD, you can still get HIV, same way.
So PrEP doesn't do anything to protect you from STDs? And
No, not at all.
Okay.
No. But most STDs are treatable, except for a couple that are lifelong, and there's even medications to help subside some of those.
And condoms you have here for free?
Condoms we have here for free. We put these all over the city. In most of the bars, they're condom packets, and they have 3 or 4 sizes of condoms in them. They're all over different bars and restaurants and clothing stores and guest houses and stuff like that.
So no excuse.
No excuse. They're available.
If you don't know who you're sleeping with, you have no idea where that person slept with.
Exactly.
And so
Yeah.
that communication and honesty seems to be at the core of this.
And that's an interesting point because they estimate that 1 in 7 people that have HIV don't even know they have it because they haven't been tested yet. So, you know, I might think I'm a healthy guy going out there, you know, I've always, you know, I never thought about it, never gave it a second thought, but I haven't been tested, and I'm healthy, I feel good, and all of a sudden, I get tested one day and I have it. So who have I slept with in the last, you know, few months or whatever?
Wow.
So
Well, how can that be possible?
what's that? What as far as what do you mean?
Over time, carrying the virus, and I realize that viruses can remain dormant,
Mm-hmm.
but we went through the gay death plague,
Right.
and people were dying within 6 months of being
Right.
exposed.
Mm-hmm.
They didn't even had time to name the disease. They didn't know what the disease was. So how could a person carry the virus and not know it?
So there are really no side effects. You know, you really can't tell. There's some people have a rash. Some people have flu-like symptom. But if I had a flu-like symptom, I wouldn't automatically think HIV. I would think that somebody coughed in an elevator or something. And so you really don't. There's not a lot of open side effects and everything for it. Unfortunately, there are still. It's funny, since last year the state or the country, state, I believe, started a new program called Opt Out. So it used to be against law to test somebody if you went into the emergency room and you had an accident. They do a series of blood work with you, but they never did an HIV test. That's something you had to sign and initiate. Now they do. So if you're going into a hospital, they tell you, we're going to do a blood test. If you have to sign to opt out. So my newest infections right now are people that had no idea. You know, the last 2 infections I've had, they had no idea. So they just had random blood work done and come to find out they're HIV positive, and they didn't know it.
Okay, so the message is if you think you're healthy and you feel healthy and everything's good, that's no reason not to come in here and, you know,
Right.
get checked out.
And the biggest thing that I try to tell people is HIV is not a death sentence anymore. You know, it's very manageable. The drugs used today are non-toxic. It's like taking a vitamin every day, really. If you keep up with your medications, the CDC says you can live as long a life as somebody that doesn't have HIV. So it's not a death sentence anymore. It's nothing to be afraid of. It's manageable.
That's amazing.
What about the stigma associated with it? How much has that changed over time?
It's changed somewhat, but I think people are still very afraid of it. People still think it's a gay disease, and it's, you know, the statistics are showing African American men are the number one, you know, of demographic and then it's Latin men, and then it's white gay men, and then it's black straight women. So kind of down that way. It's mostly hitting different classes right now. So, you know.
But when you said that you carried the virus and not know it until you had blood work, what's the time period though? I mean, you can't carry something forever and not have it not show up.
It's been known to harbor for 13 years.
Wow,
Some people without,
that long.
you know, without branching out. So yeah, it can. And then, like you said earlier, you know, some people 6 months, you know, they succumbed to it. So it just depends. Everybody's immune system is different. So
Well, I mean, this is information that people need to see or hear because, you know, when it first came out, boom, if you got it, you didn't have to go get tested. So we're going to let you know, or so the virus is going to let you know like tomorrow.
right.
It manifested itself so quickly.
Well, not everybody, but it seemed to, you know. But
Well,
most
it
people,
seems to. At least that's the way that with.
Right. And we didn't know a lot about immune systems. We didn't know how to keep our bodies healthy, and you know, and things like that. I mean, a low immune system with drinking and drugging, and you know, or a lifestyle with drinking and drugging and everything can lower your immune system. So that contributed to it also. So yeah, we know a lot more about it, and I mean, I foresee a cure someday. I really do. I also foresee a vaccine someday. It may not be in my lifetime, but you know, I think it's not too far off.
I keep reading that they say that it's within sight.
Mm-hmm.
I mean, within a couple of years, and that's very positive news.
Right. So keep our fingers crossed. So one other thing I wanted to say is that we do testing here at our offices Monday through Friday, 8 to 5, and we also do home testing. There's a lot of people that I test that don't want to walk in the door. You brought up stigma earlier. We do treat HIV/AIDS clients, and so some people foresee walking in our doors as, who's going to see me, and so we get that. I understand that. So I'll go to someone's hotel, someone's home, and I can do this rapid test in their home, in their comfortable settings. All right, so your results are that you're HIV negative, you're unresponsive.
Okay.
So this is your blood mixed with the solution and absorbed up through this chamber. There's an indicator line there for HIV, and it does not pick up HIV. That indicator line says that it red blood, so it worked.
So we know it was a good test.
You're non-reactive for HIV.
Okay, thank you.
You're welcome. You're welcome.
Appreciate that. All right.
Do this one.
Either one.
Okay. Why are you shaking?
I think it's a hole.
All right, you can count to 3. All right, he is shaking. 1, 2, 3. That's it. One up there. All right, hold that again. Can't use that first drop because of the alcohol. And it's not going to stick you. It's just going to absorb some of that blood. A little bit. Did you feel the stick or no?
Yeah, you can't help but feel it, but it wasn't painful.
No.
But like I said, it's certainly not what those what they call lancets that you used to have to use.
Yeah. And that was
I had a kid in here from Russia, and he said, "Oh my gosh, they have this instrument that has a fine. It's like a hammer, poke, and that's how they get the. But because it hurts like hell, you can pull that off." Okay.
I used to always comment that
Drop that in there.
it was less painful to have blood drawn from a vein than it was to get your finger pricked.
Not anymore. Today was much easier than having
Well,
my
yeah.
drawn last week. This is easy.
Yeah. Okay, so I want to give you your results. You are non-reactive to HIV. Your blood mixed with that solution absorbed through this chamber has a couple of indicators. Your first indicator you see right there is saying that it worked, red blood. There's an indicator right there. If it would have picked up HIV, it would have had a second line, but you are non-reactive to HIV. Okay?
Perfect.
Good.
You truly, after a confirmatory test, you're HIV positive. Again, it's not the end of the world. We're going to hold your hand. We're going to keep you well. We're going to give you all the facts that you need to know. And part of that is being assigned to a case manager. The case manager is going to help you with not only the medications you need to take, they're going to be your advocate with your doctor, they're going to be your advocate for, okay, how am I going to pay for medication? Is it my insurance going to cover it? I'm worried about this. I'm worried about how do I tell my family? How do I tell my partner or my friends? That happens here.
So the good news is that you are here for folks who perhaps have further questions or concerns or actually have a positive test.
Exactly. When someone tests reactive and they have a confirmatory blood draw that confirms that they are HIV positive, they come in and they're assigned to a case manager, and we get the ball rolling to make sure they get the medications that they need and the health care that they need to address their new health concern.
It has to be really scary though. I mean, are you there right away, if someone gets this reactive test?
It's why it's a beautiful thing that we do the HIV testing, because Randy, if someone tests positive here at our office, Randy can walk them directly into my office. I can meet people. I'm a hugger, so I can give people hugs and make them feel safe and let them know that everything is going to be okay.
I noticed
Well, we cry in this office sometimes, but not always. HIV is not as scary as it used to be. It is a very serious illness, but there are lots of very serious illnesses that people treat every day with medications and lifestyle changes, and HIV is the same way these days. So there's a lot of hope that I want people to leave the office with after getting a positive diagnosis.
And you follow through, they have a case manager assigned to them for as long as they're interested in?
As long as they'd like to receive services, we can assist. we have a lot of different funding streams. As you guys know about fundraising, that enables us to work with pretty much anyone who needs services.
Currently, how many active clients does AHMonroe service?
Right now we have around 270 from Key West all the way up through Key Largo. So we have probably about 40 clients from Big Pine up to Key Largo, so it's not that many, but we do have folks up there. The majority of our people are located here in Key West, so that's our main office is here. But we also do have a satellite office up the Keys to help those folks as well.
Where is your office in the Upper Keys?
In Marathon, it's at the Ruth Ivins Center, which is where the health department is located, which is also very handy because we're right there for the clinic days. Our clients can see the doctor right there while they're seeing us. And right now we're between offices in the Upper Keys, so we do a lot of home visits. I do case management by car, so I'll visit with someone. We can take a laptop pretty much anywhere, so I can check in on them. We can do our paperwork if need be, in a vehicle on the side of the road, in your home, at the library. All right, so case management is a tool that we use to help people manage their own health care, right? So the very first task that we have to do as case managers is an assessment. We ask questions, very thorough questions about your health history, your sexual history, your family history, all of those things, and collect all of that information. We're also asking questions about what your current needs are. So are you having financial troubles? Do you have a place to sleep at night? Do you have transportation to get back and forth to the doctor? Those are all questions that we're going to be asking so that at the end of this assessment process, we can come up with what we call an individualized care plan for each person. Now, your care plan would not be the same as someone else's because your needs are not the same. So we don't do case management by cookie cutter here. So we identify specific needs and then we work with you to get those needs met. And the ultimate outcome, the goal that we all have, is to help each person become virally suppressed. Viral suppression is it's achieved by taking medication daily and dropping that number of copies of the HIV virus in your bloodstream so low that the HIV is non-transmittable to someone else, and it's also not doing damage to your body. So that's everything that we do here has the end goal of viral suppression, and so case managers can do things like authorize cab rides. If it's raining outside and you usually ride your bike to the doctor's office, we can call and authorize you a cab. We're going to eliminate barriers. If you routinely need rides, we can give you a bus pass. If you have nutritional needs, we can refer you to our nutritionist, and we can help supply some income in the form of Winn-Dixie gift cards, right, to help you meet those essential basic needs that you have. We offer an array of services, some in-house, some we make referrals to. So behavioral health, if someone's experiencing depression, anxiety, those are very common in our population. Heck, those are very common just in general.
But I can only imagine compounding it with some news like this.
Exactly, it's a lot for someone to deal with. So we have mental health providers in the county that we work with, and we can make referrals to them to make sure that our folks are getting the care that they need. We work very closely with the HIV doctors to make sure that we're monitoring the client's lab results. And if we see that they're struggling in some area, then we have open dialogues with the doctors so that we can try together to figure out a plan to come up with better solutions so they can get to that suppressed viral load.
AHMonroe, who reinvented itself away from AIDS help,
Right.
does so much for the community with non-HIV related issues. This is a great source to come to find out where you can get medical care,
Right.
insurance, prescription help,
Housing assistance.
housing assistance. Could you explain a little bit?
Sure. We've been doing medical case management with HIV for about 30 years now. We've been doing it for a very long time. And you learn some things as you do it. You're not only learning about the HIV community, you're learning about the healthcare community in your town, in our county. So what we decided was that we could use that information that we've been collecting and learning and keeping on top of for our clients. We can really share that information with the community, especially after Hurricane Irma hit and so many people were struggling financially, struggling emotionally. That's really when we started to kind of open up and offer case management services to anyone in the community who is struggling. Now, we can't always promise funding. A lot of our funding is tied to HIV care, right? But what we can do is help someone see what services are available to them. And many places in our community have sliding fee scales for anyone, not just our clients. So we try to help people understand what's out there so that they can take advantage of the resources that we already have in our community. So if anyone has questions about benefits they receive, Medicaid and Medicare can sometimes be confusing. Health insurance in general can be confusing. So we welcome people to come in, have an appointment with a case manager, ask your questions. If we don't know the answer right away, we're usually pretty good at finding it for you.
That's wonderful. How great is it just to know that we have people here like Michelle and her colleagues that are able to fill all of these needs in Monroe County. And I thank you for what you do, because I'm sure your job is fulfilling, but I'm sure it's very difficult at
It's
times.
a great job. I get to work with a lot of amazing people, and I thank you guys. You did a lot of work yourselves, as those crowns attest. So thank you very much.
So we survived.
We did. And you know what? It really wasn't nothing.
Nothing to it. A lot of information.
Learned a lot, and it's not a scary place. Watch the whole video. It's very informative,
There's good people in there, and they're only here for one reason, and that's to help you.
right? Oh, and free condoms and the agency phone number. So
Numbers on the package, and remember, wrap that rascal.
there you go. So
And as far as HIV/AIDS, this is what we've got to say about that. Get tested.
it's very easy.